Hello, my name is Dr. Saundra Jain. I'm a clinician and an educator, and I'm absolutely passionate about the use of psychiatric scales in clinical practice. I'm so glad you've joined me today to look at one of the gold standards in the world of bipolar disorder, and that is the Bipolar Spectrum Diagnostic Scale, or what we more commonly refer to as the BSDS. Now, if you're already using scales and screeners in your practice, congratulations, and I hope you keep up the great work. If you're new to scales and screeners, I hope you'll find this video very informative and helpful. So let's take a look at the BSDS.
I believe it's worth repeating that in the world of bipolar disorder, the Bipolar Spectrum Diagnostic Scale, or what we commonly refer to as the BSDS, is considered an excellent screening tool. It's an outstanding choice for use in clinical practice. Now, if you're using another screener for bipolar disorder, there's no need to change, but you may want to give the BSDS a try and see what you think. The problems associated with misdiagnosis in the world of bipolar disorder, they are quite common and well known. In fact, to do our very best to avoid diagnostic errors, I'd suggest using the BSDS in combination with two other tools, the Mood Disorder Questionnaire, what we call the MDQ, and the Patient Health Questionnaire, the PHQ-9. This trio is an excellent combination of scales and screeners to help us gather really important clinical information in the diagnostic process. Now, let's turn our attention to the BSDS. Here you see the BSDS, which is a one-page descriptive story that captures subtle features of bipolar illness. It's not organized around yes-no questions as to whether or not a patient has bipolar disorder, but it addresses the concept of bipolar spectrum. It's a patient-friendly self-report tool, and it only takes a few minutes to complete. The BSDS has good psychometric properties, as you can see. Sensitivity in bipolar 1 and 2 of 75% and 79% respectively, and specificity for both types 1 and 2 is a range of 85 to 93%. Let's take a closer look at how this instrument is laid out. The instructions are broken down into 3 sections. Let's take a quick look. First, now I realize this is hard to read, so hopefully this is going to help. First, please read through the entire passage below before filling in any blanks. Next, the patient is asked, now that you have read this passage, please check one of the following 4 boxes. The choices are, this story fits me very well or almost perfectly. Second, this choice fits me fairly well. Third, this story fits me to some degree, but not in most respects. And finally, this story does not really describe me at all. And finally, the third section. Now please go back and put a check after each sentence that definitely describes you. As you can see, this is very straightforward. Now let's take a look at how to score the BSDS. I have some great news for you. Scoring the BSDS, it's really quite easy. Let's see if you agree. Each check mark in section 1 is worth 1 point, so you'll add up the total for this section. Then for section 2, depending on which item they selected, you'll add points as follows. If they select fits me very well or almost perfectly, you'll add 6 points. If they select fits me fairly well, you'll add 4 points. If they select fits me to some degree, you'll add 2 points. And finally, if they select this story doesn't really describe me at all, 0 points are added. So the maximum score is 25. 19 total points from section 1 plus a maximum score of 6 from section 2. Once scoring is completed, you'll refer to the scoring interpretation chart to better understand your patient's likelihood of having bipolar disorder. Now, let's say your patient score was a 7. Then there's a low probability that they have bipolar disorder. However, if they score a 20, then it's highly likely that your patient has bipolar disorder. Remember, this is not a diagnostic tool, but if it comes back positive, then I believe we're less likely to miss the diagnosis. After years of using the BSDS, I'd like to share a few practical tips about incorporating it into your clinical practice. Now, let's start at the top and we'll slowly work our way around. Make sure that you have plenty of copies readily available and sitting in full view. When the forms are stored in a file cabinet or on a bookshelf, and I've found that's right where they'll stay. If you have a practice website, you may want to provide the form as a PDF download or set it up so patients can fill it out online. You may also want to provide blank forms to patients at the end of their session. Ask them to complete it prior to their next appointment. I have several patients that do this. Another easy way to integrate this tool into your practice is to ask patients to fill it out in the waiting room prior to their appointment. The BSDS is a great way to engage patients in a conversation about bipolar disorder and provide them with useful information. Plus, it really does serve to motivate patients to be more watchful of their symptoms now that they know what they're looking for. Let's touch on a few more things about the BSDS. Screening. This is a great screening instrument, but it's also a way to engage patients in a conversation about symptoms of bipolar disorder. The BSDS is an excellent way to improve communication with colleagues, especially those that are referring patients. If we're both familiar with the tool, we then will share the same language as we're now communicating about our patients. And finally, the BSDS really is a source of motivation. As patients begin to better understand this disorder, they often feel empowered rather than afraid. And I find that they then become more engaged in the treatment process. We all remember the Nike ad campaign from years ago. Just do it. The slogan works here too. If you've never used a BSDS, I'd suggest, why don't you make this commitment? Print 10 copies of the BSDS and during the next week, use it with 10 patients. See what you think. Using the BSDS has changed the way I practice, and I believe it's improved the quality of care provided. It definitely has served as a red flag, alerting me to the possibility of bipolar disorder in many patients. Now, if you don't have a copy of the BSDS, it's very easy to find with a simple Google search. I hope that you will check out my other YouTube videos looking at the PHQ-9 and the MDQ. Remember, by combining the PHQ-9 with the MDQ along with the BSDS, that's what really creates this great trio of scales and screeners. One that creates a strong screening safety net, particularly in the world of bipolar disorder. Thanks for joining me to explore the BSDS. I hope you'll give it a try.